Exercise and physical activity are key elements in managing arthritis, and they have demonstrated an ability to both reduce pain and improve function. But how does it do this? And so we've discussed in other videos that exercise can reduce pain through its analgesic properties, and it also has beneficial impact on the cartilage in our joint. Now, in this video, I'm going to talk about two other systems, the nervous system and the muscular system, and we're going to talk about how exercise through these mechanisms can improve the pain and function in people who have arthritis. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. We have sensors in our muscles and our joints that will send some information, particularly about position, called proprioception, and movement back to our central nervous system. The central nervous system uses this information to control the muscles in our leg, which are important for controlling how we walk, which is called our gait, and our balance. Arthritic damage to these receptors has a cascade effect. It causes the central nervous system not to get the information it needs, causes the muscles not to fire correctly, causes abnormal gait and joint forces across the joint, which can lead to microtrauma, which can damage cartilage further. Proprioception can be tested, and it can be tested in a lab. And essentially what happens is the clinician will take the knee joint, maybe like this, and we'll put it in a certain angle, hold it there for a few seconds, and then return it. And then that patient has to recreate that same angle. And that is a way that we can test how good someone's proprioception or joint position sense is. And with that information, they can perform studies to see how arthritis affects that ability. And there are examples of studies. One was a review of about 11 studies with almost 400 patients who had arthritis, and they were compared to people who didn't, and they found that their joint position sense was significantly reduced compared to those who did not have arthritis. One theory why this may be happening is that the receptors are being overloaded in the joint from pain, and so they can't really function properly getting the joint position information to the receptors because the pain is overloading them. So this is one theory why this may be happening. Interestingly, in people who have arthritis of, let's say, one knee and having pain in one knee, and we know their proprioceptive or joint position sense is affected, the other knee, the non-symptomatic knee, is also found to be affected in a significant percentage of people. And the question is why? And so there are a few theories why this may be happening. One, the other knee may have the beginning of arthritis and it hasn't become clinical yet, so we don't know it, but it's on its way. The other one is that because, let's say, someone is having arthritis in one knee, maybe they're overloading the other knee, and then that's affecting the proprioceptive sense in that other joint. Or thirdly, in many people who have arthritic joints, sometimes they have reduced their overall exercise or function, and because of that reduced function and physical activity, may also be reducing the ability for joint position sense. We just discussed the nervous system, and now let's come over and talk about the muscular system. So we know from studies that because of this diminished proprioception or joint position sense, it affects the muscles. And we found that it reduces the strength of muscles and it reduces the activation of muscle fibers, meaning that if, let's say, there's 1 million fibers in one of the muscles, in a normal, let's say, situation, they would all be firing. But in arthritis, there's been affecting of that muscle, and let's say only a certain percentage of them are firing, not all of them. And this was demonstrated in a study of about 100 people with arthritis compared to a group of people who didn't have arthritis. And here again, they found that those with arthritis had diminished proprioceptive sense, so again, the nervous system. And they also found a problem in the muscular system where there was weakening of the quad muscle, and the muscle activation of the quad muscle was reduced by 20%, meaning, let's say, there were about 20% less of the muscle fibers that were being activated in those people with arthritis. And similar to the proprioceptive problem being found in the other knee, the non-symptomatic knee, again, here too, the muscular system problem is also found in the opposite side. And there was a meta-analysis, and they found that in the other knee, the non-arthritic or painful knee, also had almost a 20% reduced muscle activation. So we see that both legs may be affected because of arthritis, so it's important when designing an exercise program to make sure you're strengthening both legs. What are the implications of having reduced proprioceptive sense and weakening of the muscles? And studies have shown that in people with arthritis, it's going to lead to worsening of function and worsening of their pain. Does exercise help improve this problem? Can exercise improve proprioception? Can it improve muscle strength? And is it able to improve muscle activation? And the short answer is yes. So let's review one of the studies that have looked at this. There was a study of about 2,800 people with knee arthritis, and they found that those who were doing exercise about 3 days a week had found that they had about a 17% improvement in their muscle strength. And this has been corroborated by other studies that even found up to 20% muscle strength in these older patients. Muscle activation has also been demonstrated to be able to be improved with an exercise program. And here we see another study that had looked at about 60 patients with knee arthritis, and they compared them to a control group, and they found about a 15% improvement in the voluntary muscle activation of the leg muscle in those people who were exercising. In addition to exercise improving the muscle strength and muscle activation, it also can improve the nervous system part with the proprioceptive sense. And we had discussed this in an earlier study. Now the question is what kind of strength exercise? Weight bearing or non-weight bearing? And so there was another study that looked at this, and they looked at about 100 patients with arthritis, and they found that those who had a weight bearing exercise, like a leg press, did better than those people who were doing non-weight bearing strength exercise, like with a band. And another study of about 80 patients with arthritis in the knee found that exercise can improve proprioception of acuity by 40%. Now, some patients who have severe arthritis may have difficulty doing weight-bearing strength exercise. It may aggravate their knee in some cases. And here, some physical therapists have come up with unique techniques to have patients train proprioception while being in a seated position, and has been found to be helpful in those people as well. Let's wrap up this video and go over a key few points. Number one, arthritis can affect the receptors in the joints, which can affect the neuromuscular pathways. Number two, reduced proprioception or joint position sense can inhibit muscle strength and muscle activation, which ultimately can lead to impaired function and pain. Number three, impaired loading of the joint because of this neuromuscular pathway that's being affected can also lead to damage of the cartilage through microtrauma and inappropriate loading of the joint. Number four, exercise, particularly weight-bearing exercises, can improve the proprioception or joint position sense. Number five, exercise can improve muscle strength. And number six, exercise can improve muscle activation. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.